Get the door. Kia ora koutou katoa. Welcome back to the Ministry of Health. Thanks for making yourselves available at fairly short notice so I can brief you on the two cases that we are reporting today in New Zealand. So as you heard from our 1 o'clock release, we have had two cases. These are two women from the same family, one in her 30s, one in her 40s, who recently arrived here from the United Kingdom. They were tested yesterday and the test results came in this morning. Both women arrived in New Zealand together on the 7th of June and stayed in a managed isolation hotel in Auckland and were permitted on compassionate grounds to leave managed isolation to travel to Wellington via private vehicle on 13 June. There was an agreed plan in place as part of the approval process for the compassionate exemption, and that included for the travel arrangements. So they had a private vehicle dropped to the hotel. They then drove together all the way to Wellington and had no contact with anybody else during that trip. And they didn't use any public facilities, and they also have been just with a single family member since they arrived in the Wellington region. At the time, or prior to testing, one woman, in retrospect, was experiencing mild symptoms. The other was symptom-free. They both had testing done at the Wellington Community-Based Assessment Centre as part of their agreed self-isolation plan. I should say that that was one of the drive-through centres here, and that, of course, those doing the swabbing were using full PPE. Now, following the positive result being notified this morning, local public health staff are testing and isolating all others who may be at risk of exposure. As I said, in this case, it is just the one additional family member. Other potential contacts include people on the same flight from Brisbane and people who are in or who have been in the same managed isolation facility in Auckland, including staff. The contact follow-up is being managed by our National Close Contact Service here at the Ministry with support from local DHBs, and the local DHBs have already deployed their mobile swabbing team to the hotel, and that is getting underway presently. So staff at the isolation facility, as I mentioned, who had close contact during the period or any contact with the women will be stood down and tested. And we're also, as we do routinely, viewing footage from the period when those women transited through the border at Auckland Airport to see if there are any border staff who may have been in contact with them and be considered as close contact. If the CCTV footage does reveal that, we will stand those staff down, or they will be stood down and tested. Public health staff have also been in contact with their counterparts in Australia, so they can take appropriate action for any passengers who were on the same flight that the women took out of the UK via Doha and into Brisbane. And I can say now both women are self-isolating in the Wellington region, and we're very confident the arrangements that are in place is the best place for them to be right now. And I just want to emphasise the following point. The family has asked for their privacy to be respected, and please, I would ask that people do respect it. Now, a new case is something that we hoped we wouldn't get, but it is also something that we expected and we have planned for. That is why we have geared up and continue to gear up our contact tracing at a local level and national capacity and capability, as well as having our excellent testing capability so we can respond rapidly. We know there are people continuing to come to New Zealand. These are Kiwis returning from countries where there is active community spread of COVID-19, and that is why we have the requirement for managed isolation at the border. Compassionate exemptions are only granted if there is a detailed plan for self-isolation and testing and health checks in the community as part of the follow-up until the full 14-day period has finished. Everyone that is granted an exemption under compassionate grounds is assumed to present a risk of COVID-19 and all precautions are taken to manage that risk. Obviously, the team here that deals with the exemptions process has a great deal of sympathy for families who are coming to terms with a dying relative or friend or are bereaved. But today's news underscores the recent decision to not grant exemptions to attend funerals or tangihanga, where there may be large groups of people present under Alert Level 1. More details about the response being taken by our health authorities and advice to the public around the case will be provided in my subsequent updates. So now our total number of confirmed cases in New Zealand is 1,156, and we will report the additional cases through to the WHO. The combined probable and confirmed number is 1,506. We don't have any additional COVID-19 related deaths to report, and of course there is no one in hospital at the moment. Yesterday our laboratories completed 1,527 tests, and the total number of tests to date is 312,648. Just a final comment before I open up for questions. These cases are ones we have identified effectively at the border, and you will recall that in fact we haven't had any cases coming through the border or identified any at the border for some weeks, and it's not surprising we have got cases, especially in this instance where people have come out of the UK, where we know there is still a lot of active infection in the community, and it underscores the arrangements we have in place at the border, including the arrangements in place to manage risk if someone is granted an exemption on compassionate grounds. I'm open for questions.
Are you going to amend the rules now for exemptions?
Which part of the rules?
Are you going to take a look at the rules around how you decide who does and who gets an exemption? Is there any changes that we can?
There is already a very detailed and clear process for applying for, and criteria are laid out very explicitly about the grounds on which exemptions will be granted. We receive many more applications than are granted. There are, just to reiterate that if an exemption is granted, there has to be a very thorough plan that's pre-approved to help manage the risk. The only other thing I will say, in this instance, the women did everything that was asked of them, and they, through their travel and through what they did down here and in going and get tested, what I have asked from today is that anyone being released for a compassionate exemption is tested, and there is a negative test result received and confirmed before they are released. In this case, there was quite a short period of time. The relative died quite quickly, the exemption was granted, and the plan was approved. And again, I want to just support the efforts that these women have gone to abide by the agreed plan.
You mentioned there, though, that retrospectively they did have symptoms. I mean, you said they did everything that was asked of them, but it's not rocket science, though, is it? If you don't feel well, you need to reveal the symptoms. Did they not have the correct information?
They had the correct information. The person who did have some symptoms put them down to a pre-existing condition. They were non-specific, and so that was where there was. So someone had some symptoms, but they attributed them to a pre-existing condition rather than to the onset of an illness.
How did they travel from Auckland to Wellington without stopping?
By private vehicle, and they didn't use any public facilities to take a toilet break.
So what did they do?
Well, I won't necessarily go into details, but there is a lot of empty roadside between here and Auckland. So again, they, I think, were assiduous in making sure they did not put anyone else at risk, and I want to just commend them for that.
Did they have enough fuel to get from Auckland to Wellington?
They must have had a vehicle that was able to do that.
Why did they self-isolate the two women after they visited their family member in Wellington? Did they continue to self-isolate prior to getting there?
They are staying with that family member, in fact, in a separate place on the property. So the only other person who is a close contact is that family member. They've had no other contact with anybody else.
How long were they in self-isolation before they got the exemption to leave?
Yes, so they arrived from Brisbane on the 7th of June. They only applied for the exemption on Friday the 12th of June. I sense that they may have thought they had more time, but unfortunately the relative died that night, and so the process was expedited to grant that exemption and agree the plan the next day, so they could leave that day and drive to Wellington.
Do
Well,
you
you're in
feel
managed
like,
isolation. You're asked by a nurse every single day if you have
Hmm.
any symptoms. They run you through the list. I went through it. Are you saying that these people dismissed it themselves and didn't tell the nurses, or that they told the nurses and the nurses dismissed it?
I think this is one of the things we want to check. My understanding is that the person who had the symptoms was asked, "Are you okay?" And as you've just described, actually, the protocol is to go through each individual symptom and ask, and it may well have been that would have elicited specific symptoms that may have led to suspicion. But again, I think this individual attributed her symptoms to a pre-existing condition.
do you think that the pendulum swung too far back the other way? Because we were here asking you questions about whether you weren't giving people enough leniency. Are you now giving too much? And do you have to take into consideration the likes of the other people in quarantine, like nurses and health workers who are at the hospital with those dying people?
Look, these are all matters that need to be weighed up. And again, just to reiterate, there is a really thorough process for considering any exemption and requirements around a very clear plan to manage any risk. We have got the requirement on anyone coming in for the 14 days isolation unless there is an exemption. We have added in the testing over and above that. And just to reiterate, I've made it clear today that anybody leaving a facility for whatever reason needs to have had a negative result. If the test on this woman had been done and it had been, positive, or both women, they would not have been allowed to leave at that time. So we're adding that. It's striking the right balance here. I think we've got the balance right, but of course this gives us an opportunity to look back and learn and fine tune so that we're even better prepared.
On granting exemptions, you not test them before they would like to leave their shelter?
Usually, in this case, the process was expedited because of the specific circumstances and the confidence that there was a really clear plan in place. And again, there has been no risk to anybody other than the family member they were with, who will of course be in self-isolation, monitored, and also tested in due course.
Does that mean usually they are tested, but
Yes.
exceptions made?
Correct. And what I've just made clear today is that whatever the circumstances, a test should be done, and a negative test result is a requirement of release.
Which hotel were
How many
they?
people are
Sorry,
coming through your borders at the moment, and is this a sign of things to come? Should we not be complacent? I mean, since we've gone down to level 1, people seem to be a little bit more complacent.
Thank you. Yes, we should not be complacent. We need to remain vigilant. And I've said it before, there is a pandemic raging outside our shores. We're all aware of that. And as Kiwis return, as they are able to from all around the world, and we have got more coming in, there are several hundred most days, then that's why we have these processes in place. And so it's a reminder to us all we cannot afford to be complacent, and even under alert level 1, we're not out of this yet.
How were they asked?
So there's a question down the back here.
Sorry, how many people were on the flight from Brisbane to Auckland? Was it an
Yep.
Air New Zealand flight?
It was an Air New Zealand flight. I don't know exactly, but all those people will be in a managed isolation facility and will be being tested, or if they have been granted leave on compassionate grounds, we are following them all up to ensure that they have been tested or will be tested now.
How was it determined who was granted a compassionate exemption for a funeral versus who wasn't?
You mean generally? Yeah. Well, there is a clear set of criteria that are applied. You will recognise that since alert level 1 came into effect at midnight between Monday and Tuesday, compassionate exemptions are not granted so people can attend a funeral, only to perhaps visit a dying friend or relative, or to grieve with a small group of family members. And in most instances, that is a sort of like a day leave pass, and then they go back to the managed isolation facility.
Which hotel were the 2 women in, and have all of those people been contacted, or will some of them be listening to this and need to get in touch?
It's the Novotel Ellerslie is the facility they were in. Everybody who is currently in the facility is being held within the facility and will be tested, and the teams are there doing that now. Anyone who has been in the facility and may have left since the 7th of June will be followed up by a national contact tracing service.
Just
Will this delay any departures?
Sorry, here.
People are supposed to be tested on around day 3 of after entering the country, and then later on again. Were these women not tested at all prior to their sort of national exemption and so on?
That's correct. And what I can say is that last week we went into alert level 1 very quickly. And so we focused the testing on the day 12 testing before people leave. And just from this week, we've added in the day 3 testing as well. Just to reiterate the point I made, the message has already gone out to all facilities that anybody leaving the facility must have had a test before they go for whatever reason. Now.
Just to clarify on that question, sorry to follow up, were those rules were in place, were they not followed correctly?
The testing was being introduced. In the first instance, we focused on making sure anybody who was due to leave was being tested, and now the day 3 testing for others, so that everyone will receive a test at day 3 and at day 12. One of the issues here is that the requirement for that testing will be covered in a new order that is still to be approved. I have asked for advice on the current order, which has been in place since the 9th of April, and under that order, only people who are deemed to be low risk can be released from managed isolation. And I've just made it clear that I won't deem someone to be at low risk unless they have a negative test result.
Just to clarify, how many people in total now under suspicion as close contacts will need a test? Just the one, or just to clarify?
Close contact here in the community is just the one family member, but we are treating others who were in the same hotel or are in that hotel as being close contacts, and likewise anyone on the flight, including crew, will be assumed to be a close contact and tested as
Do you have
such.
a number on that?
I don't, but we will be finding that out and we'll release that.
Were they ever asked to wear a face mask even when meeting with family members?
I don't know exactly, but I do know that what I can say, because I was in the discussion with the public health unit this morning, is when they left Auckland, they had a supply of face masks. So that would have been probably part of their plan as well, even when interacting with their family member at home.
Well, suppose that's within the order. How quickly can we get it through?
So I don't, have the detail around the process, but my understanding is it's about 5 to 6 days. But in the meantime, I am very comfortable that under the extant order, that people can be required to be tested to help assure us that they are low risk before they are released from managed isolation.
One family member, are their contacts being traced now in the event that they do test positive later?
The family member,
Family member who's-
yes. So recalling that the women only arrived in the Wellington region on late Saturday evening, and they have only had contact with that family member who's also just been at home with them.
Do you think
How
that
worried
contact
are you?
tracing ability needs more work, or is this as good as it's going to get?
We're continuing to work on it, and it's very good now. I'm very comfortable with that. This is will be a good test for it, but I also we are planning to, as you might say, stress test it over coming weeks as well, with some tabletop exercises and just making sure that all the processes work really smoothly.
Just on that testing, how many people in their context can we trace, and over what period of time? Is an update on what that could look like?
So at the moment, we have the ability to trace several hundred cases at a time, and then you'll recall at least 10,000 calls a day if required. So this will be a few hundred. In this case, of course, the contacts are all either in managed isolation or have recently departed, so we have very good information about them. So our aim here is to trace 100% of these people. We know exactly where they are.
How nervous are you that these women have infected more people?
I'm not nervous about that, and what we are doing, of course, is doing exactly the right thing by isolating any potential close contacts and testing them all.
Were these women tested before they got on the plane in London?
I don't think so, but I can't say. There are not many countries that require pre-departure testing per se, because you need to. What I'll tell you, what I can say is that they didn't have any unwell family members or friends in London that they can think might have had an infection that they could have been infected by. So it's possible they picked up the infection either in the UK or at the airport, or potentially on one of the flights. So these are all the stones we want to uncover, particularly the flights.
Yeah, and do you know, do they both have the same strain of the virus, or do they have different strains of the virus? Is that too early?
Yeah, too early to know. However, I would say that almost certainly they've both been infected either at the same time or one has infected the
Have
other.
you gone back to reject any exemptions that you may have let through following this on? Is there any, have you gone back to change any decisions?
We haven't gone back to changing decisions. However, what we are doing is we are following up any people who were on the same flight who may have been granted exemptions and also have been released from managed isolation already. They are being followed up and will be tested, assessed and tested. And we are also intending to go back and look at any person who had an exemption since, the 7th of June, just to check that testing had been done prior to departure and or from a managed isolation facility or as part of their plan once they were in the community.
Can I clarify a couple of things that we've been told that a woman from the US recently on Saturday had applied for an exemption before the June 9 cutoff that disallowed that for funerals, and then was allowed to go to a funeral. Is there any? Can you confirm that? And another thing that we've been told is that there were 2 teenagers who were given an exemption to go to a funeral in Hamilton recently, and after that they were unable to be located. And have they since been tracked down?
Sure. On the first question, I can't comment on that particular case, but another thing I've just made clear to the team today, regardless of when people came into the country, whether it was under the Alert Level 2 or the Alert Level 1 arrangements, we are under Alert Level 1 and there is no limit on funeral size and no particular requirements around contact tracing. So therefore, people should, whenever they came into the country, if they are still within that 14-day period, should not be able to attend a funeral. So if there's a specific case there, I'm happy to follow that up. Regarding the other 2 individuals, I am aware of this that happened, I think, towards the end of last week. Both of them have been were tracked and traced. One is back in managed isolation and the other one is in an agreed community isolation arrangement, and I want to thank many people who are involved and the work that was done with police and the local community and iwi to help sort that out and reduce the risk to the wider community.
How much time has passed since they were? We didn't know where they were.
I'm sorry, I don't have the detail on that.
Is it just a waiting game now? Do we need to wait the 2-week gestation period to see if any others have been infected?
Well, the testing will help us there, and that's why we are making sure that anybody who we think is may have had close contact with these people or been in the same facility, so where there may have been a risk of transmission via a fomite and an inanimate object. That's why we're testing everybody, so that will help us assess what the residual risk might be.
Just quickly to clarify, when was the funeral and what were their initial plans in terms of how long they were going to be in the country for?
I'm not sure about the latter, but they were released to be with a grieving family member and plan the funeral, which was always planned for next week anyway. So after their full 14-day period had finished, now they will be restarting that 14-day period in the managed isolation. Any final questions?
So they will miss the funeral.
No, they will defer the funeral till when they can all attend it, when they are all finished that period, that 14-day period, which has just restarted.
And is it a mother or father, or what's the relationship?
Well, it's a parent who has died, yes.
Can I just ask, does this put the clock back to 0 now? We were on 24 days without cases. Does it put it back to 0 now?
Well, I guess it does. But again, just to reiterate, we expected more cases. The good thing here is we're maintaining what I believe are relatively high rates of testing, given that we have very low rates of influenza-like illness in our community. We're now clear that anyone in a managed isolation facility must be tested before they go. It's another part of our belt and braces. And we have an opportunity here to, again, review and refine and fine-tune our arrangements. Final question?
I just want to ask, because you said this restarts a 14-day period for these women. I assume that was if you didn't test positive for COVID. So does the 14 days apply even if you test positive, or are you kind of kept isolated until you stop being sick?
Well, the 14-day period will apply for their close contact, which is the family member. In the definition of recovered for these people, if they've tested positive, is that it's at least 10 days since the onset of symptoms, if they've had symptoms, and a 48-hour period of being symptom-free. So that will apply here. I suspect they'll all want to stay together for that full 14-day period. Final question.
If the women had used a rental car, and if that was the case if there are any concerns around those vehicles.
The information I have, it was a private vehicle that was dropped to them by a relative in Auckland. So I don't have a concern about the rental vehicle. Thank you very much, and we'll look forward to updating you on any further details.